for our stakeholder call regarding the Legislative Analyst Office analysis of the Governor's Healthy Families proposal. If you're just joining us, we please ask that you do *6 to mute, and you can unmute later when we get to the question and answer period. Please do not put us on hold if you have a background music, unless of course you have muted your phone. My name is Sonia Vasquez, which is a nonprofit community-based health organization that health and quality of healthcare coverage policy area. Many of you Coalition and LA Access to Health Coverage Coalition. However, we understand that several of you are coming from our other CHC coalitions and through our partners, and we welcome you for participating with us today. Again, I want to remind everybody that this is an open conference call, so we ask that you mute your line. If you don't have a mute phone, just press *6, that mutes your line, as well as unmute your line when we get ready for the question period. Joining us today from the Legislative Analyst Office, we have Jana Olsen-Morgan, who is General and Fiscal Policy Analyst, and Sean Martin, who is the Managing Principal Analyst with the Health and Human Services Policy area. So I'm going to go ahead and turn it over to them. They're going to do a quick presentation, and then we're going to open it up for questions and answers. So Jana, you want to take it away?
Thank you, Sonia, and thank you for the opportunity to speak to you all today. So as Sonia mentioned, we're just going to run through briefly sort of the governor's proposal for this year, what our office found when we examined that proposal, and the alternative that we're suggesting in place of that proposal. And I'm going a little bit light on the background, assuming that many of you sort of are familiar with both Healthy Families Program and Medi-Cal, but I'd be happy to sort of answer any questions that come up after we've run through it. So the governor's proposal, just to outline it briefly, proposes to reduce the negotiated rates that Healthy Families Program currently pays to managed care providers to bring those rates in line with Medi-Cal. And they found that this rate reduction would be equal to 25.7% on average, and that rate reduction would become effective October 1st, 2012. Additionally, they're proposing to shift all of the Healthy Families children, which is approximately 878,000 children, who are currently enrolled in Healthy Families to Medi-Cal by June 30th, 2013. So the budget assumes that this would result in net savings of $64 million general fund in 2012-13, and then ongoing savings for the full year of $91 million. So the governor has proposed that this shift takes place in 3 phases. The first phases, which is about a little under half of the program for Healthy Families, would be the kids who are currently enrolled in Families Managed Care Plan that also directly contracts with Medi-Cal. So presumably, these are the kids that would be least affected by transitioning into Medi-Cal. And that phase would occur from October through December. The second phase, which would occur from January through March of 2013, is, again, a little bit under half of the program enrollees, and these are kids who live in counties that currently have Medi-Cal managed care plans, but are in plans where they might subcontract with plans that contract with Medi-Cal. So essentially, they can move into a Medi-Cal managed care plan that may or may not be the same plan that they currently have under Healthy Families. The third phase of kids who would be shifting from Healthy Families into Medi-Cal would be in areas where there currently is no Medi-Cal managed care plan. So they would be transitioning into a fee-for-service Medi-Cal. And this is 43,000 kids, so the remaining sort of 5% of the program. Additional to this proposal to shift Healthy Families kids into Medi-Cal, the governor has also proposed separately to expand the Medi-Cal managed care plan into all of the 58 counties. So that would bring Medi-Cal managed care into 28 counties that currently only have fee-for-service Medi-Cal. So I just wanted to mention that as sort of a concurrent proposal that's important in considering this. So when our office looked at the governor's proposal, we found that it did have some merit, but it also raised some budget and policy issues for us. So we found on the merit side of things that it did consolidate healthcare programs in the state. And by consolidating those programs, it does improve the continuity of care for some families. So specifically, families may be switching from year to year between Medi-Cal and healthy families. By sort of shifting that bracket, you may find that there's less shifting or churning, as people refer to it. Additionally, because of the way the eligibility is set up, which takes into account both age and income, there are families currently who have one child in Healthy Families program and one child in Medi-Cal. And by shifting all Healthy Families kids into Medi-Cal, you would also have some families would benefit from sort of having all of their members, children in one plan. We also found that there is a benefit to implementing some of the Affordable Care Act requirements early. There's a lot to be done in the state, and sort of getting a jump start on those actions can certainly be beneficial. When we sort of looked over the proposal, however, we did find that there were some areas of concern, both on budget and policy areas for us. On the budget side of things, their budget year savings in particular, their estimates around how much money they're going to save in this year could erode if Mr. Mib can't reach that 25.7% reduction. So the way that Mr. Mib, which is the Managed Risk Medical Insurance Board, and they administer Healthy Families program, the way that they negotiate with healthcare plans is through a negotiated process, and those healthcare plans may or may not be willing to accept nearly a 26% decrease in their rates. And so to the extent that they can't reach those decreases in rates, the savings that are projected in the governor's proposal are going to erode. However, you may still see some savings as kids would shift into Medi-Cal, which does on average cost less to the state than Healthy Families. We also found that there will certainly be a disruption for Healthy Families enrollees as they're switching between Healthy Families and Medi-Cal. And that disruption can be particularly problematic for kids who have either chronic or complex health conditions where shifting a provider could be more troublesome. Additionally, there's a percentage of those children, those ones in that phase 3 shift, that would be shifting from a Healthy Families plan, which is all managed care, and then they would be shifting to a Medi-Cal fee-for-service plan. And then if the governor's expansion of managed care into all counties is passed, they would then be shifting from Medi-Cal fee-for-service into a Medi-Cal managed care plan. So for that sort of 5% of the program, those kids would also be sort of transitioning back and forth between sort of various different managed care to fee-for-service, managed care again. So that could also raise some continuity of care issues. We also found that the proposal to shift all of the Healthy Families children into Medi-Cal could impact the access to providers. Although the benefits are largely equivalent under both programs in terms of the list of benefits, the access to providers may differ between the two programs. If you're adding in an additional nearly 1 million kids, it could stress that Medi-Cal provider network. Additionally, we found that this is a fairly large proposal, and it does interact substantially with the Affordable Care Act. And therefore, we believe that it should sort of be considered in the context more broadly of federal health care reform, which allows the state to have several different options about where to place the Healthy Families program. So under the federal health care reform, the state has the options not only to have it as a standalone program as Healthy Families, or put it into Medi-Cal and just sort of has it as an expansion of the Medi-Cal program, but the program could also be situated under the exchange program, the exchange board. And so bearing in mind sort of all of our findings, we recommended that for the current year, the legislature just shift the portion of enrollees who would be shifting under federal health care reform anyway. So these are about 186,800 children who are in families with incomes between 100% and 103% of the federal poverty level. And these, in 2014, these are the children who would be shifting to Medi-Cal. So we suggest that this portion of the Healthy Families program is shifted earlier, which would allow us to sort of have a pilot program, see how the access to providers is impacted, iron out some of the problems that may come up, And then we recommended that the broader discussion of the future of Healthy Families program in the context of healthcare reform should be referred to policy committee so it can be discussed in that venue, which we feel is more appropriate. We also suggested that Mr. Mibbs would be involved in the discussion around the different transition options in the day report. I think that carries us to the end. If we do have sort of a subset of recommendations if the legislature does adopt the governor's proposal. I think for us the most important key highlights if they do adopt the governor's proposal is that we consider the feasibility of maintaining the contracts in some of those rural counties where there is no Medi-Cal managed care, that we maintain the contracts with the Healthy Families Plan managed care so that those children aren't bounced around between so many different programs. And with that, I'd be curious to hear what questions people have.
Okay, great. Thank you, Yana. So again, if you have a question, please unmute your line, press star. Six to unmute your line. We ask that you give your name and the organization.
And to let the partners know that the AAP had done a study of our member pediatricians in California. We get some information about information from Yana also in the LAO. I can only be on the local, this is why I'm commenting here, but if anyone does have questions about the underlying survey or pediatricians' concerns about access, I'm my email address. So if that comes up and I've had to leave the call, please let anyone know. I'd be more than willing to talk to them.
Great. Thank you, Chris. And Chris,
so we don't quite have it yet in a form with and so if there are questions that come up through your organization that you feel would help the AAP based on what we have learned from the pediatricians, we have the same position that they do. But if anyone's still formulating or wants additional information and you think some additional knowledge from the pediatricians, practicing pediatricians would be helpful to you, go ahead and shoot those questions to me and we'll see whether we can incorporate them and get that information for you. Okay?
Great. Thank you, Chris.
All right, thanks. Bye-bye.
Oh, is Chris off the line now?
I think so.
Oh.
Sorry, I'm here for about 10 minutes, that's all.
Oh, okay. Well, I did skate sort of lightly over the use of the survey results, but we did consider the survey results in informing our analysis. And so while I think Chris hasn't published the survey results, you will find on page 10 of our report a reference to when we looked at her data, what we found was that there was, it just sort of definitely backed up the point that some pediatricians may be unwilling to accept children who either switch from being in Healthy Families to Medi-Cal or accept new Medi-Cal children where they didn't previously accept Medi-Cal children.
Do we have any other questions from partners? Just press star 6 to unmute your line. Sonia? Yeah, I'm sorry, who was?
It's very static.
Yeah, Anna, we're having a little trouble hearing you.
I'll email you my question.
Okay. Okay. Not a problem.
This is Fatima with Community Health Councils, and actually this question came from a partner on a call that took place yesterday. And the question was around whether or not the LAO, the budget analysis that is included in your report, or if there will be a future analysis of this issue, but really looking at the increased cost that the state may incur as a result of Healthy Families children with who are, covered by their parents' employer coverage who will become eligible for Medi-Cal in the transition. Has there been any discussion or any assessment of what the increased cost or the impact on budget savings would be as a result of these children now being eligible for Medi-Cal and the cost that would place on the state?
Well, I think I got to see this question early from Chris as well. Firstly, children who have employer-sponsored insurance through their parents are not actually eligible for Healthy Families.
Right.
So there's no overlap between that. Now, if you're talking about children who will become eligible for Medi-Cal under federal health care reform, and therefore you're imagining that parents may drop their employer-sponsored insurance to enroll their kids in Medi-Cal, is that sort of the gist of the question?
Right. So the Urban Institute did a similar analysis of sort of this transition, and one of the things they highlighted is that there isn't that Medi-Cal doesn't bar, children whose parents could have them on their employer-sponsored insurance, as is now in Healthy Families. You have to go through the ESI of the parent. Medi-Cal doesn't have that, and so the logic may be that some parents will drop coverage through their employer because Medi-Cal may prove to be a more affordable option. So just an analysis of how many kids may then sort of enter Medi-Cal who right now
are above the Medi-Cal eligibility.
Mm-hmm. Yeah. We have not done an analysis of that impact. I think it would be very difficult to get.
I think it would be hard for us to get data, and we'd have to make assumptions of what people would do. But no, we have not done an analysis of that, nor are we planning to publish one soon.
And I thought I'd heard that Healthy Families applicants, about 6% of them are denied because they have employer-sponsored coverage and because of the crowd-out period. So I don't know if there's any estimates maybe from Mr. Mibb or their vendor that would be helpful in trying to get at this data point.
I think there are sort of broader, firstly it's sort of outside of the scope of this piece, but I think there would be broader issues around sort of judging. There are different opinions about how likely parents are, in fact, to try to enroll in Medi-Cal, or whether there's a stigma attached to Medi-Cal, and so there's a lot of sort of complex personal choice issues around what families choose to do with insurance, even if they are eligible for Medi-Cal. So I'm not sure that piece of data would sort of enable us, sort of knowing that 6% are crowded out from employer-sponsored insurance.
It's helpful, but I'm not sure we could base an entire analysis on that.
Well, I don't think it's 6%. Well, I think it's relevant because doesn't that affect the enrollment estimates and therefore the budget estimates? Because if the department didn't include those kids who are now denied Healthy Families coverage but could enroll for Medi-Cal, if the transition were to happen, then wouldn't that effectively mean more kids enrolled and so therefore higher costs or more savings, or however you're looking at it?
If you assume that they did enroll into the Medi-Cal program, you'd have to make an assumption about how many of the 6% then chose to enroll in Medi-Cal. And as far as I know, that the Department of Health, as far as I know, the Department of Health Care Services didn't factor that in, but they have a complex model, and they may have, and we just don't know about it.
Okay, thank you.
Do we have any other questions for partners? Just press *6 to unmute your line.
Hi, this is Christina from LA County. Can you hear me?
Yes.
Okay, hi. I have a question. Regarding the 25% that the administration is well, Mr. Mibb is estimating that would be the successful reduction in reimbursement. I don't know if this is something for the LAO's office, but maybe what are the odds of that happening? What's the likelihood of health plans accepting a 25% decrease? Would it be more likely?
We're not handicap it for you, sorry.
It's certainly a popular question, but
right.
I think as Sean said, if we came out with an estimate, it would in fact hurt and hinder Mr. Mibb's ability to.
Okay. Yep,
We didn't want to undermine their negotiating position.
Right.
Yeah.
This is, and handicap it.
The best we can say is that there are certainly concerns around that issue for savings.
That have come up, in hearings. And
okay.
It's not generally people here are not all assuming that will be achieved.
Okay.
We're waiting for an update at the time of the May revision to see how likely it is that we'll achieve some or all of those that project savings.
Right. Okay, great. Yeah, I saw that at the end of your report. Okay. Thank you.
Thank you, Christina. Any other questions?
Yeah, hi, this is Mike O'Day again at Children Now. So I had a question about the rate reduction because I've heard two different things, and so I'd be curious what LAO's take on it is. I've heard from the Department of Healthcare Services that the 26% reduction does not apply to dental plans, but then Mr. Mibb is saying that they have a consolidated rate, and so they're considering it a sort of across-the-board cut. So what we're trying to tease out is if dental plans will be affected, and similarly with some of the other services like mental health that's carved out. And I think you allude to it in the report, but I'd just love to hear you speak a little bit more about what your understanding is of the rate reduction.
Our understanding is that it's sort of the latter description, that 25% is on average across, and the way the trailer bill language is structured, they're bringing healthy families' negotiated rates in line with a number that DHCS will determine, which captures Medi-Cal rates plus carve-outs to bring the benefit packages sort of equivalent to healthy families. So the way that language is structured, the rates that they're bringing in line with Medi-Cal rates would be the Healthy Families Plan, which sort of are a more comprehensive, holistic, for lack of a better word. So my understanding is not that dental plans were excluded from that in some way. You have to look into it further.
Yeah, I don't remember on the dental particularly, so I'm not sure.
Okay, thank you.
It's a good question.
Thank you, Mike. Any other questions?
Hi, yeah, this is Christina again. I have a follow-up question. I really am glad that you included your recommendations about referring to policy committee and looking at what are the other couple of options, of standalone healthy families, and also looking into placing into the exchange. And I was wondering, did healthcare services then not look at that third option of placement into the exchange? And do you know if there's been a plan, a study or any research done on parents, and just knowing the likelihood of perhaps a parent that's in the 133 to 250 range applying for the exchange, knowing that their child would be in a plan with them? I don't know if there's any data or any statistics on that out there.
Are you thinking about what the likelihood would be of those parents? Are you asking about sort of like the change in the likelihood of the parents, like whether their actions would be affected by knowing that their child could be in the same plan as they would be, or just their likelihood of enrolling through the exchange at all?
Either one, actually.
I think it's certainly an interesting area to look into. I haven't seen any studies precisely on like whether families would be affected by the capacity to enroll in the same plans. I mean, under healthcare reform, there's sort of a fiscal component if you don't get healthcare coverage. So I think it would be reasonable to assume that many people who are eligible through the exchange will take advantage of those financial incentives to get healthcare coverage through the exchange. But our office hasn't come out with anything, any analysis of that particular issue yet.
Yeah, and I'm trying to think of all the studies I've read through on exchanges and the Affordable Care Act. And I can't think of one I've read that is a specific issue you're asking about.
Okay.
And it may just be that it's still early in the game, and we're still standing up our exchange. And it almost seems like one of those questions, though, that the exchange board would be grappling with.
Okay.
And that's certainly, certainly one of the reasons that we made that recommendation to refer to policy committee is, and why we sort of felt like moving the entire program at this juncture would be premature, is that a lot of the sort of planning that the exchange board is doing hasn't been completed yet. So it's very hard to sort of judge at this point in time whether the children will be better off in plans with their parents or in healthy families as standalone or in Medi-Cal, because the exchange board hasn't sort of gotten to the point where we can really analyze that yet.
I think it would be good for the exchange board to have an opportunity to weigh in the policy committees on what their views are.
That would be really interesting. Okay.
Yeah.
Great. Thank you.
You're welcome.
Thank you, Christina. Any other questions?
This is Fatima again with CHC. There were a few questions that arose in sort of discussions with our coalition partners, and I'll just put the two out there. One is, will the Legislative Analyst Office be conducting any sort of analysis of, what the impact on counties will be? I know when last year with the governor's proposal realignment, there was a lot of analysis of like, well, how does this actually trickle down? So one, that was a question by partners, and two is, have you had any response from legislative leaders or committees regarding the recommendations you included in your report, both, the recommendation to just transition a few of the kids, those that would transition under Medi-Cal, but also the recommendations you provide, should you just go with the governor's proposal, some additional recommendations around fee-for-service and an exemption process, but just generally, what's the follow-up been with the release of the report?
And why don't I address your second question first? And unfortunately, the answer is we can't really. So the legislative response, but I can say that there's hearings up this week, and so it may be an issue that will have more clarity sort of in the week.
We're getting a little feedback noise, so if you are not speaking, if you could please press *6 to mute your line.
You're registered. I'll see you on the list. There was no registration. I said, gee, normally I'm used to putting my name and everything.
Again, if you are not speaking or asking a question, we ask that you press *6 to mute your line.
And then on the second question, do you have any reports on a particular topic in the pipeline right now? So as for addressing the local issue you just raised, no, we're not planning on publishing something in the near future.
Do we have any questions? Any other questions from our partners? I think you did such a thorough report that there's no need for any additional questions. So, okay, well, any final thoughts, any questions from anyone before we close out?
And I would certainly be happy to answer any other questions via email or phone. I believe my number's on our page and on the report.
Sure.
So feel free to call.
Yeah, if you have questions, call us up directly.
Yeah.
Okay. We sent out the report with the initial invitation email to everyone, so you should have that. You can contact Yana or Sean directly, or if you want, just give us a call at 323-295-9372, extension 235. You can also email me at Sonia, SONYA, at chc-inc.org. If you have any questions, we can make sure to get that to Yana and get those responses back to you. If you did not RSV register for this call and you received the number on your own, if you could just shoot me an email so we know you were on the call and we can give you any follow-up information from this call. Right? Well, thank you, Yana and Sean, for joining us today. We really appreciate the report, the thoroughness of your report, and your ability to, and your willingness to come out and talk to our partners today.
Sure.
No problem. Thank you for the
Thank you.
Take care, everyone. Have a good day.
Thank you.
Thank you.